Hi, friends, and welcome to another Darling Bish Hour with our dear friend
Yes.
Amy Phillips. Hi,
And our
Amy.
dear friend Melissa Reich. Hi. Hi,
Hi,
guys.
how are you?
Well, I'm doing okay, I have to say. This is not our normal kiki time, even though I know we take
No.
on some serious topics. This is one
Mhm.
that certainly left me pretty scarred, I have to say, about what we're going to discuss. So, immediate trigger
Yeah.
warning. Melissa will give you all those trigger warnings momentarily. We may not have as many laughs as we normally do.
Maybe not, although I do love an inappropriate giggle.
Sure.
But, I'm going to try my best, especially with the mood that I'm in. My brain is just like not firing on all cylinders, but Amy is right. So today what we're covering is Maternal Instinct on Netflix, which is truly one of the darkest, most horrifying documentaries that probably I've ever seen,
Me too.
which
Yeah.
puts it in perspective because, I'm a true crime girly and
Mhm.
I watch a lot of true crime, but this Maternal Instinct, when I watched it, I felt a really important need to cover it, but also knew that it would be a challenge, right? We're
Yes.
not kikiing, we're not talking about housewives and something stupid that Alicia said. We're talking about very serious psychological issues here, but there's a lot for us to talk about. So at the top, I'm going to give a trigger warning that we are going to be talking about, a lot of things. We're going to be
Yes.
talking about murder. We're going
Mhm.
to be talking about specifically death of an infant, of a mother, and we're going very, very violent, very disturbing details. We're going to be talking about personality disorders, and I'm going to talk about the difference between cluster A, cluster B, cluster C, things like that. I just encourage people to use their discretion because what we're about to cover, it's no joke. This
Yeah,
is intense.
I think that any trigger warning that's ever put out there, I think that you should just assume that there's a trigger warning for this because it really does, it covers pretty much everything out there.
Yeah, from murder to deceit to just things that a regular human brain has trouble processing all of this, which is why I feel called to cover it.
Yes,
Because so many
I agree.
people have asked, why and what's going on. And so,
Everybody's talking about it, everyone's seeing it, and it really is, I think, like the number one documentary on Netflix right now, or at least this week. And I was shocked by the end of this because I did not know this story. I have to be completely honest with you. I felt so sick to my stomach, I almost threw up. That's how
mm,
bad.
yeah.
And truly have done very much of a deeper dive past this just to
Yeah.
find out more answers to some of the questions that I had because the documentary can only cover so much. And they did a great job. So there were a
Mhm.
lot of unanswered questions, just details here and there. So I did do a little investigating with that. And in doing that, I know Melissa has covered so much of the clinical aspect of it. And I'm going to be posing questions to her just from, the viewer perspective, the pedestrian perspective, as to what maybe you guys would be asking someone like Melissa, since she's got an amazing background and truly has her finger on the pulse of all this. So I'm very interested. I think that this was an awakening for me on many
Mm.
respects in terms of personality disorders.
Yes.
This was a huge awakening for me to understand what this is. And
Mhm.
it also became a personal thing for me because I know someone who has personality disorders much like this. And I never
Mm.
understood how serious that can be. And now I feel like I am getting it. So for that, that's why I am grateful for these types of documentaries and covering these things.
Yeah, wow.
Yeah.
And the thing that I'll say is like everyone experiences personality disorders differently. And I look at everything clinically on a spectrum from not problematic on one side to pathological on the other. And for me, who has worked with people in practice treating personality disorders and things like that, this case to me it's very intense and it's like nothing I've ever even watched or seen before. So yeah, let's get into it
Wow.
with I'm going to share a little bit. I'm going to share the
Yes.
synopsis.
Yes. Do a
And
synopsis. Yes.
also for people listening to this, if you haven't watched Maternal Instinct, please know we're about to tell you what happens. So I don't even want to call them spoilers because this is not like
Yeah.
great entertainment.
Right. We're
I don't even
telling
know
you,
how to describe it. You know what I mean?
you're going to know what happened in this story by the end of it.
Yeah, I'm about to tell you what happened. So if you don't
Mhm.
want to know, tune out, watch Maternal Instinct, and come
Mhm.
back. Okay, you've
Or
been
don't
warned.
watch it.
Or
Just
literally
listen to
don't.
this. Yeah.
And just listen to this, because I definitely know that there is some people, especially if you've struggled with infant loss or child loss, this can be very triggering to folks.
Yes.
So
Yes.
the synopsis. Netflix Maternal Instinct is a harrowing true crime documentary detailing the 2020 murder of 21-year-old Reagan Simmons Hancock in New Boston, Texas, which, by the way, New Boston, Texas is a very small town. I think it was like a population of 1,500 people. So it's worth noting because, things like this typically don't happen in very small towns, but dangerous people live among us. And I think that's the scary thing and also important to know.
Yes.
So continuing with the synopsis, it chronicles the chilling lengths to which Taylor Parker went to maintain an elaborate fake pregnancy, which culminated in her brutally murdering Hancock and surgically removing her unborn baby to pass off as her own. So I'll give you a little bit of the case background, and then we can start talking a little bit about it. So the deception was this woman named Taylor Parker. She faked a pregnancy for months to deceive her boyfriend, Wade Griffin. Her elaborate ruse included fake ultrasounds, a maternity photo shoot, and a gender reveal party. The crime took place in October 2020. Taylor Parker attacked her friend, 21-year-old expectant mother Reagan Simmons Hancock, in her home. Taylor Parker murdered Hancock and cut her fetus from her womb while her child was in the next bedroom, which I added that because there's another level of pathology and antisocial behavior that goes to that. This woman killed this woman, cut her baby out, and took the baby and left the child there. It just disgusting. And then the aftermath was hours later. Parker was pulled over by Texas State Police, hysterically claiming she had just given birth on the side of the road. When they got to the hospital, medical professionals quickly determined she had not been pregnant. And so with the overview of this documentary is that the film uses police body cam and dash cam footage, hospital interactions, and interviews with investigators to piece together Parker's devastating web of lies and ensuing police investigation. And what I appreciated about this is that rather than sensationalizing Taylor, the murderer, the documentary really focused in the second half on the victim's family. They interviewed Reagan's mom, her sister, her stepfather, and they talked about how they navigated this tragedy. And so before we start talking about it, I just wanted to say that a lot of true crime docs get it wrong. I believe this one really got it right in terms of doing right by the victim and the family and everything like that.
Yes.
So where should we start, Amy?
I think one interesting part of the documentary was that there were interviews with all the people that you said, but also people that knew Taylor Parker when she was younger. And they were the ones who were aware of how dangerous, or maybe not so dangerous as they could have ever anticipated, but they were aware that she put on fake personalities. She would adapt to other people's stories and made them her own. She was a pathological liar. She was constantly saying there were things that were wrong with her. She was saying that she had cancer, that she had a stroke, that she had MS. She had a multitude of problems and issues throughout her life. And so these are some of the earlier friends that she had maybe in middle school through high school that were speaking to that. So they knew her very well. They were not in touch anymore. So it's interesting to hear their testimonies about her, because Facebook is a place where they're all watching some of this stuff happen with the pregnancy photos and things like that. And the biggest aha was that Taylor Parker couldn't have kids anymore because she had a hysterectomy.
Right.
And she had been married.
And that's what's so bizarre about this whole case is that as we unravel some of the details, it gets to the point where you're like, well, how on earth did she expect this to end? And so many people became aware of the grift because the friends that you mentioned, Mackenzie and Abby, were the two friends that were interviewed. And to me, they gave the best insight into Taylor
Yes.
because personality disorders, they're present in childhood, but they really form and solidify in early adolescence and early adulthood. And so I find it fascinating when before the disorder presents, there's behaviors that we see. And the behaviors that Mackenzie and Abby talked about were what you mentioned, that she had always said that one of them said she stayed sick. She was sick all the time. She said she had cancer. She said she had MS, and she had a hysterectomy. So the other people that participated in this, Northeast Texas Women's Health Center, and they saw the post, but they couldn't break HIPAA laws.
Right.
So they were in a really tenuous situation.
Right. And the story kind of begins with this, well, what Taylor always probably wanted, which was this love story of being with someone and having a baby. But this is Wade, who she got with, and that's where the story really takes flight. Before that, and we know nothing much about this at all, but she was married twice, and she has 2 kids, of which she does not have custody of. This takes place in Texas. When she met this man, Wade, I think they met at a rodeo. She said she wanted a quote for land because she claimed that she had oil money.
Oh my God. Yeah, she was an oil heiress, honey.
Oh.
According to her, she was an oil heiress. But yeah, they met at the 2019 rodeo, and she was telling Wade and everybody her family was rich and she was inheriting wealth, that her grandmother was a multimillionaire, $8 million. And basically, she approached Wade and was like, here's what I can give you. And then all of a sudden, she was buying cars, cattle, side-by-sides, tractors, which, by the way, I know not everyone is going to know what those things are, but those things are very large pieces of equipment. And one of the biggest early red flags was Taylor bought Wade's mom a car and posted it on Facebook.
Oh, she posted that. Okay.
Yeah. To me, Facebook is a really integral part of the story because
it is.
There is a lane of Facebook that is like attention-seeking folks who are like, something's wrong with me every 5 seconds, prayers, GoFundMes, etc.
Yes.
It's like a grifter paradise on Facebook, if I'm being honest.
Funny.
And I think that, and then that car, by the way, that she posted on Facebook ended up getting repossessed.
After 2 weeks, yeah.
Right. But to your point is that when she met Wade and she told him all of this stuff and they got together, she really didn't see the kids a lot. Like they didn't talk a lot about that. And I don't know if some of the info that you got, Amy, some of the other background info tells us what happened.
It doesn't. I haven't come across any of that, but it was very strange to the family that she didn't have custody, and it was noticed. But only after 1 month of Wade and Taylor dating did she start saying, my mother, she's trying to take this money from me. She's trying to sabotage my life. She's trying to put a hit out on me. She's trying to kill me. We'd be safer if we lived with you, Wade. So she moved in with Wade. She sold all of her stuff.
She didn't have a lot of stuff to sell.
No, she sure didn't.
Because Wade's mom noticed that. Wade's mom, there were a couple other people interviewed in this. One was the mother of Wade, some friends of Wade, a real estate agent, and one of Taylor's ex-bosses.
And Reagan's mom, right?
Yes, Reagan's mom, Jessica, her sister Emily, her stepfather. Right. And so they really got a great cross-section of folks to tell the story. It wasn't just like one person's side. It was so many people's side. It was just so well done. So well done.
So after she moved in with Wade, this is when things really started to escalate quickly with the lies about all the money. I saw this later that she pretended that she had a miscarriage with Wade early on. I don't remember hearing that in the documentary. So I'm not exactly sure if that's true, but then she said that she was pregnant. And
despite literally, she did not have a uterus or cervix. It was removed. The doctors that removed it confirmed this. They were interviewed. And it was after that she claimed, she went to one of Wade's family members who was a chiropractor, and she said, I feel in my spirit that I'm pregnant. And I was like, well, that'd be the only place you could feel it, lady, because that's, you got nothing going on.
And when she actually had the hysterectomy, apparently there was some trauma that happened where like she had an ectopic pregnancy.
Yes.
And
she
so
had her tubes tied.
Okay, right.
And then she came back because she had pain, and they found it was like, despite having whatever surgery she had an ectopic pregnancy, which would have been fatal if they didn't take care of it. And then she also had like a cyst or something. It was some sort of a real medical thing, not one that she made up, because she did make up a lot of medical things, which, by the way, you are always going to see that in grifters. There is some form of like people used to call it Munchausen disorder, but that was just an inaccurate name. Munchausen, interestingly enough, it was named after this guy, Baron Munchausen, who just told tall tales. But it's really called factitious disorder, either imposed on self or imposed on others. And it's essentially, making things up, making yourself sick, or making up medical records, doctor shopping, doctor hopping to try to get the diagnoses that you want to have. And this particular characteristic, the reason I'm pointing it out, it's present in a lot of scammers.
That's interesting. Interesting.
Yeah.
Okay.
Mm-hmm. It's kind of a red flag.
Wow. Yeah. It's just free with purchase. It just is there with the kid, no matter what. That's really interesting. I didn't know that. Okay. Well, on top of that situation, when she did get that ectopic pregnancy, she was married at that time to, I believe, her second husband. And for some reason, maybe at the time she had been put under for surgery, but they made a decision without her to have a full hysterectomy. The husband made that decision for her.
Oh, Amy, okay, that's the last piece of the puzzle that I did not understand.
Yeah.
Okay. So the husband decided for her.
Yes.
Oh.
And I believe that's correct. Now, I'm leaving, a little bit of elbow room for me being wrong, but that's how I know that she said that, and I know that that has been out there and stated in other publications and things like that. So that being said, she currently is using, I don't know the name that she called it, fetal abduction syndrome, something like that. I don't know. You might be able to tweak the words, but it's something that has to do with fetal and syndrome, and when you try to take someone else's baby, that she is saying that that is what she had because of the trauma that she experienced with her hysterectomy.
Well, of course, she's going to say that.
And
right,
and
of
from
course
prison.
She's going to say that.
Right, of course. And she's also saying that being in prison, it's like a whole new life. She's so glad this happened because now she can try and help people and bring awareness to this syndrome. Yeah.
Amy. Okay.
No, it's so messed up. But anyway, getting back to...
We're going to call some bullshit on that, number one. Also, I'd like to say I survived ovarian cancer when I was 17, and I also woke up to people telling me that my things were gone.
Oh, my God.
And I was 17 years old, and I've never tried to steal a baby. So I'm just saying...
Well, there you go. And this
I'm joking and I'm laughing, of course, but I sincerely
you are the
understand.
Perfect person to be able to speak on that. So thank you, Melissa.
Yeah,
I'm so sorry.
And professionally, it's like I've never, gone and tried to steal a baby or murder anyone. It's just like people like her, they'll come up with any excuse for why it's not their fault. And we're going to talk about this later in terms of how personality disorder is different from mental illness.
Yes.
Because that is the response of someone who is committed to themselves, and that's about it. So, because that's insane. Yeah.
Yep. Okay. Well, one of the other things that I found out, not in this documentary, but in other places, is that her ex-husband contacted Wade and told him that she has had a hysterectomy and she cannot have kids. He contacted him. And there is a current civil lawsuit for Reagan's family suing Wade for basically willful ignorance because of these types of things.
Which is really, yeah. And so to be clear about what Amy's saying is that for people who feel bad for Wade Griffin, everyone told him. Mackenzie and Abby, they ended up knowing a friend of the family. They told Wade's mother, who told Wade that Taylor can't be pregnant. She has had a hysterectomy. She neglects the children that she does have, which, by the way, for someone with these problems, they don't want the child. They don't want to parent. They want like to present a child, but then like parenting is the polar opposite of what they're usually looking for, because parenting is, it's not glamorous. You don't get attention for the day-to-day ins and outs of tough parenting. She wanted the attention. She wanted the spectacle. She wanted the gender reveal and the baby stuff, but she didn't actually want
The
to
pregnancy
raise
photos.
a child.
Right.
Right. But to go back to what I was saying is that Mackenzie and Abby told Wade. Wade's mother told Wade. Corey and Stephanie Ott, who were friends of Wade, told Wade. They begged him. They pleaded with him. She is not pregnant. She is lying. She is making this up. And so to your point, there was a lot of willful ignorance. And listen,
and she was wearing this fake pregnancy belly, and he never saw her belly. He never asked to see it, or if he did, her excuses were, I don't feel comfortable in my body, I'm insecure. And so for literally 10 months, 10,
10,
he never forced his way to see this actual belly.
People were talking about that too, because there were photos of her that at times she would have this belly and at times she wouldn't. But do you want to know the one really interesting piece, Amy, while I'm thinking of it? If you notice something, Taylor Parker, in every picture that they show of her, she looks different. Did you notice that?
Oh my God, Melissa, I was going to say the same thing. I have been dying to talk to you about this. I can't figure out her face or what she looks like. And that, to me, is the most bizarre part, considering that she isn't the person you think she is. Every single photo, every mugshot, every video, everything. It's like not the same person. What is that?
I'm being very mindful of how I say things here, because I want to be really clear about something before I move forward, is that I am not diagnosing Taylor Parker. I am using her case and looking at symptomatology, almost like a case study, to say, here's the disorders that could fit this. I am not diagnosing her with anything. I just want to be really clear. But what I attribute that to is the fact that she had such a distorted sense of self. She had no self-esteem, no self-awareness, no self. It was just so distorted that I believe her disconnect with self was so severe that it came across in every single picture of her. And we're not joking. Every jail interview, before she was arrested, after she was arrested, even her court appearances, every single time she looks different. And I believe that is indicative of the disorders that we're talking about, these personality problems that are lifelong, that are fixed, and, our bodies and our minds are one. And I've never seen this before.
Really?
But it was something, I've never seen it in person, but it stands to reason that because she feasted on other people's lives, because she didn't have her own, it's like her friends, Mackenzie and Abby, said it was like she feasted on other people's lives to get more information about her grift so she could. Like, she learned from her boss, like, who had like a child loss. And then she learned from her friend who had a pregnancy. And she just took pieces from these people's lives and pasted them together to form her own life, which is inherently indicative of personality disordered kind of characteristics. But that's what I think that is all about. Yeah.
Wow. I am so glad you brought it up, because I'm thinking, am I just the only one seeing this? Because this is crazy to me.
It was so pronounced that I'm going to tell you, my husband, who is not the most observant fella on the planet, straight men, I'm going to be honest, their perception, their observational skills are a little bit lacking. No offense. I'm sure. I don't know how many straight men listen to the show. Maybe there's one. If there's one, thank you for being here.
And you are very perceptive.
But my husband even said, he goes to me, why does she look different in every picture? And I was like,
wow.
Even you noticed it. That's pretty good. So it's pretty significant if even he noticed it. Yeah.
Gosh, that's wild. Okay. Well, thanks for pointing that out. That's nuts.
So she did 5,000 internet searches based on court evidence that they showed a few of them in the documentary. And I wrote some of them down because I felt that they were so fascinating.
Yeah.
So she would go So Wade was willfully ignorant. And because of that, I believe these deaths happened and I believe that they were preventable, but he just wasn't. I'm going to be honest. I feel like Wade was more interested in the money.
Yes.
And trying to have a better life. And listen, I'm not judging Wade because there's a piece of it that it's like being whatever you want to call it in a lower socioeconomic status, being a hardworking blue collar person. I understand that this promise, it hooked him in, but she did that on purpose.
Yes.
So Wade is a victim too,
Yes.
but unfortunately, he engaged in behaviors that it muddied those waters a little
and
bit. What do you think about that?
I completely agree, and I think that she chose him for a reason. Clearly, he's very ignorant. He's very dim. His reaction,
not observant
at all, and absent to a lot. For example, when he was told in the interrogation room by the investigators, police officer, that there was a murder and that she took the baby and so on and so forth, his reaction was, my parents, I should have listened to my family. And it wasn't at all like she killed somebody. Like it was more about, I should have listened to my parents. It was a very odd reaction. And I know that that's shock, I would imagine. But even still, I haven't really seen a lot of his remorse towards the victim themselves, and that was weird.
Right. That was weird to me too, and I didn't love that. When he was interviewed, he was very a man of few words. He didn't show a lot of empathy towards the victims. Now, that doesn't mean he doesn't feel it. He just seems like a man of few words and maybe not as expressive as one might expect.
And maybe it took, hold of him later, and where he did seem pretty overcome with emotion at the end. And he also said, I think it was like the last thing in the documentary, which was him saying, I think she wanted me to tell her I loved her, but I never did.
Right. And so then you have to ask yourself the question, well, what was the end game and why did she do all this for a man that she knew didn't love her? But that is the reason, because a healthy individual, right? They wouldn't choose a person who wasn't into them. They would say, oh, this person's not into me. Let me move on into a better relationship. But someone with her characteristics, she also has a lot of antisocial characteristics, meaning she, criminality. Like at the end of the episode, we learned that, she had 30 aliases. She tried to buy $20 million of real estate, making up people like lawyers, bankers, an uncle. Things like that. And
Can I just mention here's the little dark humor for you. So she said that, she had oil money, Shell, right? So the letters that she wrote to the real estate agent on behalf of the Shell oil company, or the representative who gives her the oil royalties, her name was Shelley. And her lawyer, I think his last name was like Lawlesson or something.
Lawless. Yeah.
It reminded me of like Arrested Development when he's like, I'm blah, blah, blah. It's just, you can't, that's how someone like her must keep things straight, because she can remember her lies because she's making them so easy to remember the name. But, yes. And, moving on to your point, she had apps that disguised her voice. Distorted her voice so that she could make these phone calls. She had burner phones. She had so many numbers. She had a blocking app where you could block your IP address. This is where it gets complex. And you think that she's just some, Texan. If you were to just, slap an empty label on her, you'd just be like, this is just some Texas crazy woman. It's like, no, actually, it's so layered to the complexities of her diabolical behavior and the work that she actually did to pull this all off. And Melissa, as we said, this town, 4,500 people.
No, 1,500.
Shut up. 1,500?
1,500. Yeah. New Boston, Texas, 1,500. Yeah, it's very small.
Oh, it's way smaller than I thought.
Yeah.
Okay. So the doctors saw her Facebook post. Now that's going to tell you how small this town is.
Right.
If they saw her pregnancy photo shoot, you know what I'm saying? And they're like, HIPAA, we can't say anything.
But
And
then
mhm.
people would call, like Wade's family would call, and they would say, well, we can't give you information, but I would trust your gut.
Oh, yeah, that's
That's
right.
what Wade's mom and his aunt and some friends, like they all got that information and they called every place that she claimed to go to and they all had the same thing to say to her.
Mhm.
Yeah, so it's like everybody knew, but the
Mhm.
only person who could do anything about it, Wade, literally until the police told him she murdered someone and cut her baby out and claimed to be her own. It literally, it's like the light bulb didn't go on, which
No.
is just like, oh my gosh, that's
No,
insane.
not at all. She's texting Wade as her mother, saying, "Do these
Oh,
horrible things to her,
yes.
push her down the stairs so you can be free. She'll probably kill herself."
Which, by the way, she was writing those, and I think that was her projection. So this is what I took a
Mhm.
note on, is that when she was pretending to be her mom, trying to tell Wade, like I wrote it here, she would say to herself, like, calling herself like a fat bitch, but like pretending it wasn't her that was saying it. And so my belief about that is she was projecting how bad she really felt into these texts. It was almost like
Yes.
another way for that personality component to come in, if that makes sense.
It completely makes sense. She even, like, told on herself by saying, like, she'll kill herself like she'll try to kill herself
Right.
like she's tried to do before, which we don't really know about, and we don't really know if that's true.
Well, people with these personality styles, let me put it this way, they care too much about themselves to usually do something like that. Like people who are highly narcissistic or have a lot of narcissistic traits and tendencies, they'll kill somebody before they ever take their own life.
Mm.
Usually for the
Mhm.
most part. I mean, there's definitely
Yeah.
exceptions to the rule, but again, I think that was her ploy for attention and, I need to be taken care of. Wade needs to take care of me. Even though it's like, it's weird because she was doing all the things. She was cooking dinner,
I
she was
know.
mowing the yard,
Yes.
but it's like that's how she got him because the only thing
And
he
also
cared about was that.
his
Like the things that she did,
that
like
yes.
coming home to a home cooked
Yes.
meal and then she would bake a pie or whatever. And then he just wouldn't ask any questions. And he was a simple
Right.
man and she
He was a
knew
simple
what to
man.
spoon feed him to get him
Yes.
to, participate in this.
And she charmed his whole family.
Oh my
His whole
gosh.
family immediately were like, marry this one. She's great. She came on with this great personality,
Yeah,
right?
one of
Didn't
them,
she?
sure, yeah. Yeah. And listen,
Wow.
I'm not saying
Are you saying that
no, I just wanna be clear. Multiple personality disorder is so it's basically called dissociative identity disorder. I'm not saying she has that. I
right.
believe that she has various personality disorders, but not dissociative
Mhm.
identity disorder. No. Those
Okay.
people aren't
Right. Got it.
aware, it's not purposeful, there's not ego,
Yes.
there's not narcissism. That's a whole other thing. Yeah.
That's a whole other thing. And I get what you're saying because it's like she is choosing to play this role.
Yes.
It's a choice to be this type of personality during this moment to get what she wants.
Correct. Yes. Very antisocial, very, I'm going to use crime and aliases and lies to get my needs met. And I don't care who I have to step over or step on or hurt or kill because it's only about what she wants at the end of the day.
Now, Melissa,
Mhm.
oh, one thing. By the way, this is happening during COVID, which is which is great for her because that's why Wade couldn't go to any of the doctor's
That's
appointments
right.
for her pregnancy because she's like, "Oh, you can't come, it's COVID." Okay, so I just want to put that out there.
Yeah.
What I found extremely fascinating was there were no priors. She had no record. How is that possible at this point in her
I'll
life?
tell you. Because women
Okay.
who have these personality issues are typically able to get off the hook because this is where the patriarchy and misogyny actually helps women who are inherently problematic because she looked kind of like, I don't know, like a cute girl. You know what I mean? Like she was just like a regular
Mhm.
gal. She looked kind of cute. And because she was able to be such a manipulator, people would know, like her friends would talk about these weren't the first lies she told. Like she was a liar basically since birth. Her mother said that. She's just like always lied. her friends Mackenzie and Abby said. She mimicked people. She would ask girls for nudes to catfish guys when she was like in high school. And so my point being is these behaviors were there, but women who are con artists tend to get away with it for a long time because they're viewed as the fairer sex, or a woman couldn't possibly do this, or she doesn't look like she could do something like this. And that's how dangerous women maneuver all the time.
And on that note, she was married 2 times. She didn't have custody of her kids. And we don't know what happened there, but clearly not fit. When she gets with Wade, why and how did things escalate so quickly, literally over 11 months, 10 months maybe, to where she became a photographer on the side to do like family photos. And that's how she met the victim, Reagan, who was getting married. And she found Taylor probably through Facebook, or
she
through
was
a friend of a friend
budget-friendly.
Said this is a very inexpensive. And not a professional photographer.
Right, but Taylor was the photographer at Reagan's wedding, which is so gross.
And her engagement photos.
Right.
And they became
and before
friends.
She did this to Reagan, she sought her out to continue that friendship. To me, this was a long con.
Okay.
In my opinion.
Yes.
But to your point, it happened so quickly because Taylor manipulated it to do that so that he didn't have time to think. So this is what I wrote down, like, how did this happen? Okay. So the first step was, my mom's crazy. I need to move in with you for protection.
Okay.
Then the second thing was, I'll give you everything you want. I'll have dinner ready. I'll mow the lawn. I'll take care of the animals. I'll pull my weight. Number 3, I have money and I will buy your love. And then number 4, rushing. It doesn't give you time to think. With intimate partner violence or domestic violence scenarios, you'll often find these very rushed timelines because people, sometimes they're not capable of faking it for long enough and they want to really get their grift in.
Wow.
But B, it's a mechanism to prevent people from thinking about the decisions that they're making.
Wow. Wow. Rushing.
Yep. So, and unfortunately, Reagan, Jessica, her mother, really advocated for her in this documentary. And she just said that Reagan was a beautiful soul, someone who loved other people and wanted to be there for people who didn't have others. And Taylor knew that. She picked her victim, unfortunately, extremely well, which tells me she has skills that are, again, antisocial in nature, of like predators. They can sniff out weaknesses in others. It's like nothing I've ever seen before. It's like a sixth sense. They're so scarily good at it. And I think that's something that Taylor understood. In fact, Taylor sought her out, I think, the night before she killed her. And they went out to dinner. They spent time together. And to me, again, that's very indicative of like an antisocial lack of empathy, because so she hung out with Reagan, knew what she was going to do the next day, went home and got a fitful night of sleep, and then took the baby and left her child there. It's just it's so predatory. I guess I just want to be really clear about that.
That makes so much sense. And it is my understanding that she was stalking women and not just her. So those answers for me that I got, those were some statements that I discovered that didn't go any further than that. I'd like to know a little bit more about how many people was she currently stalking? How many people has she stalked in the past to potentially execute other grifts, as you say?
Right.
And what a perfect position to put yourself in as a family photographer, because you ingratiate yourself to these people and you make it makes them seem like you're so great. And that's why Reagan liked her, because then she's saying, I've got these problems with my husband and I just came out of a divorce or whatever. And now there's a connection.
Right. I mean, and that's how she used her femininity to get away with murder too, because again, you're not going to suspect the female photographer from your wedding and your shower, and she got people feeling bad for her, because with her history of feasting on people's lives, she had these stories to tell that weren't hers, but she knew what she was doing when she took these stories from people and then fed them to other people.
Right.
And I think that's just, it's just
Now,
really sad. It's unfortunate.
how could this have been stopped? So many questions here because her mother, the understanding that I have is that her mother was living in somewhat a little bit of fear because she would take care of her daughter, Taylor's daughter, and she was afraid that Taylor would take the granddaughter away from her if she were to do something, So she's just trying to keep her at bay. Although, am I right that her mother did tell somebody that she couldn't have kids? Isn't that correct? Didn't the mother
That
speak
is
out
also
too?
correct. Yes. The mother spoke to people. Yeah. She wasn't on the documentary. They showed a picture of her, but she did also try to help. Like when whoever called her, was it Connie Griffin, Wade's mom, or one of Corey's friends, someone called her and she said, I've been waiting for this call. Thank you.
Oh.
I've been waiting for this call, she said.
Oh, yes.
The mother said that.
Yes, the mother said that. Yes.
Mm-hmm.
And so, you've got all these people that know, and they're kind of just waiting there. The friends from the past, waiting there to see what she's going to do because everyone's told Wade, what else can they possibly do? Because how could you anticipate something so gruesome? No one could have anticipated that. Could they have? Because she's never displayed murderous traits before. How could they have expected this? Would the mother have?
As I was watching it, I saw all the red flags in terms of like stalking and obsession with another woman's child. So I wanted to get back to that. Her friend, Mackenzie or Abby, I forget which one was pregnant. One of them was pregnant. So she and Taylor were friends. They bonded over not being able to have children, but then the one got pregnant. And then Taylor became obsessed with her pregnancy. She wanted to go on her tracking app. She wanted to go to her doctor's appointments.
Oh, that's right. She wanted her tracking app login.
Yes. And it spooked her so bad, which, by the way, this saved her life. I'm telling you right now, the only reason this woman was alive to tell this story is because she listened to her gut and said, I need you out of my life. I'm not talking to you anymore. And then Taylor had to look for a new mark. I fully believe, I will say this with my whole heart, that her friend would have been the victim if she had not cut her off. Number one. Number two, when you see the flags of the pathological lying, the planning, the internet searches, how to fake an ultrasound, order cheap silicone belly, private infant adoption, newborn adoptions, how to file birth certificate for home birth, how to find a birth mother. And then her last search was video of a C-section. She literally watched on YouTube a video of a C-section, knowing that what she was going to do to her friend that she just spent time with that night. And so the stalking, the obsession, the pathological lying, I could see that something really bad was coming. Unfortunately, an average person most likely is going to miss those red flags.
Yeah, because they are not seeing this. They're not seeing the internet searches. They're not seeing that she's stalking this person and laying the foundation. And, when things are to the end, it's 9 months. She doesn't have the baby. She's telling everybody that she's going to do this appointment, that appointment. And now it's 10 months and everyone's going like, what's going to happen?
Yeah. What?
She tells Wade that she's going to go to a different hospital, one that's like in Oklahoma or something, because she can't go to the ones in Texas because they all know she's full of shit. So she can't go there. So she says that she's set up like a C-section or whatever, an appointment to get to have the baby. And that morning, she sets fire to the fucking house.
To Wade's house. He wakes up and he's like, the house is on fire. And he's like, I had no idea how it happened. And it's like, really? You don't?
Yeah, you don't?
Sleeping next to the enemy. And not only that, but she sent him to sell hogs like 4 hours away. So she set his house on fire. She sent him 4 hours away to sell these hogs. She called in a bomb threat to Mount Pleasant Hospital using one of her her voice hiding apps because it said it was a male subject. And we're like, that was Taylor. That was Taylor. I mean, come on. And then she told Wade to leave to go sell the hogs. And then she went, killed her friend, took the baby, and just drove down the road thinking that people were going to be like, yep, you know what? This tracks.
Yeah.
That is so wacky to me. That is
Okay. So it is like, so this whole plan that she had, which was to get this guy, have a baby, and she's executing this situation. And at the very end, she ends up having this baby, which, by the way, does not survive, obviously, and neither does Reagan.
Right.
Rest in precious peace, and I will never forget them ever.
No, literally, I think about Reagan and that baby. I'm not kidding a lot. I don't even really believe in God, but I've said prayers. I'm just like, I hope they're at peace, because the empathy and the grief that I feel, not even knowing them, I'm like, to do something like that, you have to really, we'll get into this and I'll explain what I think is going on, but primarily you have to lack empathy inherently. You couldn't do something like that physically. They said at the end, there were 113 sharp force injuries to Reagan. 113. That is 113 times that she made choice after choice after choice to continue with this. And that just shows complete lack of empathy. None whatsoever.
The doctor even said that he could not believe the way that she had done that, because I can't even discuss that. I can't even talk about it.
You could watch the documentary. He talks about how she did it and how she did it incorrectly. But I agree. People can watch that if you want to. Yeah.
Now, the doctor did say in the documentary that because they all knew that something was going to have to give with Taylor because her due date was passed, and what's she going to do? So the newborn unit put out a code pink. Which basically meant, like, she could come and steal a baby. So they were...
Right, because that's what they thought. She's going to try to steal a baby. No one ever thought that she would try to kill somebody to obtain a baby. Which that's where, I guess personally as a professional, I feel a lot of people failed Reagan and her child in this scenario.
Yes, I agree.
Because I think at this point, if you're doing that, there should have been other interventions that needed to happen. And I think there could have been more that could have been done.
So HIPAA, you can't get past that, right? I mean,
no, you
just
cannot.
Can't. And so, I kept thinking, like, isn't there anything? And no, they did everything they could by saying, trust your gut. You're on the right track. Follow the breadcrumbs. Like, they did what they could do. And I mean, certainly that's true. They never could have anticipated what was going to happen. So when she's in the car and she has this baby, Melissa, after all of what she did to get to this point, where did she think it was going to end? And how does someone who's that specific in terms of planning this whole ruse fail with an ending?
Because the ironic thing about people with, whether it's antisocial personality disorder or different types of personality disorders, it's not logical. It's like,
it's just impulsive in the moment thinking.
There's a lot of impulsiveness. And so we can start to talk about this if you want to.
Yeah.
It's some of like the characteristics of some of these like cluster B personality disorders.
Yes. Let's talk about the personality disorders. Thank you. Okay,
let's talk about that a minute. So the first thing that I want to say, because Amy had asked this question and it was such a good point. What is the difference between personality disorder versus like a mental health disorder? Because when you hear the colloquial term, for example, crazy, this is not somebody who was delusional or not understanding what they were doing. She was not psychotic. She was in charge, aware, and making active decisions. And so personality disorders are technically a type of mental health condition, but they differ from mental illness like depression and anxiety in their duration, number one, how the person views their symptoms, two, and treatment, number three. So let me explain. Mental health issues, like major depressive disorder, for example, which I have. I have major depressive disorder and I have PTSD. They can occur at any age, fluctuate, and be episodic. But personality disorders, the big difference is they are rigid, lifelong patterns that typically develop in late adolescence or early adulthood, as I had mentioned. Now, this is the key thing. People with mental health issues usually recognize that their thoughts or feelings are causing distress. But individuals with personality disorders often see their behaviors as normal or a necessary part of who they are, attributing their problems to external sources. So when Taylor said that she has this like alien abduction syndrome or whatever she tried to say she has, she's trying to blame something that's clearly not her when this is all her. She ruined many families, generations, the ripple effect goes on, but she's in jail saying, well, this is why I have trauma and this is why this happened. And no, that's absolutely not. So the mental health conditions affect how you feel or act, but a personality disorder fundamentally distorts a person's sense of self, how they relate to others and the world. And I know that was a lot, but does that make sense? That's the difference.
Yes, it does.
Yeah, it's
but
confusing.
I had no idea how serious personality disorders are. And to me, it almost seems like they're worse than mental illness because like, and I know that you're going to say, no, that's not necessarily true or whatever, but I'm just, in my opinion right now, they seem worse because like when I see the term or the title, the category, mental illness, that seems really intense. And then I see personality disorder, that seems less intense. So that's why I was like, why aren't we putting that under mental illness? Because mental illness is, it should be the umbrella that encapsulates all of the issues that we have going on because it's mental. And if we're ill on some level, why wouldn't that be under that category? But I understand what you're saying, that these are very separate. Why aren't people talking about this more often? Because maybe you're like, actually, they do a lot in my life. And as a matter of fact, it's quite obvious. But
it's so common for people to not really, this is not something probably only a clinician would really know. These are not things that the average person is going to understand. Like I went to school for years to understand, to learn about this stuff. Then I worked on it in private practice in my career and all of that. So it's okay to not, like when you look at a person, a personality disorder, mental health issues, they're invisible a lot of times. You can't see it on the outside. And so it does. It leads to confusion. It leads to misunderstanding. But the one thing about personality disorders is that they're less treatable, but only because when you're struggling with a personality disorder, there has to be two things present. I believe that anyone can change. I really, truly believe it. I've seen people change. I've seen miraculous things happen, but you have to have two things. And one is awareness and the other is motivation. And those are the two things that people with personality disorders most often don't have.
Wow.
However, I don't want to paint all of the personality disorders with the same brush because we're talking about, so there's cluster A, there's cluster B, and there's cluster C. Now, cluster A is otter-eccentric, and under that falls paranoid, schizoid, and schizotypal. So those are personality disorders, which is differentiated from schizophrenia, which is a delusional disorder under mental illness.
Wow.
Yeah.
Wow.
And they're, and they differ, which again, we don't have to, they do differ, but we don't have time to go into that. But cluster B is where a lot of so cluster B is dramatic, emotional, or erratic. And so under cluster B, we have antisocial personality disorder, which is characterized by disregard for the rights of others, impulsivity, and a lack of remorse. And so antisocial, this is where if you hear the term sociopathy or psychopathy, this is kind of usually what those broad umbrella terms talk about is antisocial personality disorder. So as children, you're going to see a blatant disregard of rules, maybe some conduct issues, getting in trouble with the law, disregard for authority and lack of remorse, things like that. And you also, this is where you see the dark triad of traits in terms of like setting fires and like abusing animals and things like that. That would fall under antisocial. Borderline personality disorder involves mood swings, unstable relationships, a fear of abandonment, and identity disturbances. But people with borderline personality disorder generally are not aggressive. They may self-harm. That happens a lot with borderline personality disorder, but that's not typical, right, for people in that category. Histrionic, it's defined by a constant need for attention, shallow emotions, and a highly suggestible or theatrical behavior. And then the last one is narcissistic, which involves grandiosity and excessive need for admiration and a lack of empathy for others. Okay, I know that was a lot. I believe she has, by the way, comorbidity is very common. When you have one personality disorder, you can experience others within the same cluster or different clusters. And in my opinion, she meets a lot of the criteria for a couple of these, in my opinion. Now, there's cluster C, which is anxious or fearful. And those are like obsessive compulsive personality disorder, which differs from obsessive compulsive disorder, which is, it's all a lot and it is very confusing. But the point of what I'm saying, it's very common for people to exhibit traits from multiple disorders across multiple clusters. If that makes sense.
It does. Yes. Does she span, I mean, in your opinion, does she span A, B, C, or is she just mostly in B?
I think she falls in B for the most part, but you know, there's a certain level of delusional thinking in terms of like reckless or impulsive, in terms of what we talked about, where it's like, well, there was no plan there. Like you knew you weren't going to have a baby. So what were you like? I think she was just so used to lying and getting away with it that she wasn't accustomed to running into like a closed road for her. You know what I mean? She wasn't accustomed to consequences or having truth get in the way. And so for me, it was a lot of things that led to this, but a lot of very complex things. But yeah, that would have to be my thought. I think she really has some very antisocial, criminal, narcissistic, attention-seeking, all that.
Can personality disorders be treated with medication?
No, not with medication. So they're hard to treat because they're deeply ingrained. However, there are therapies like CBT, cognitive behavioral therapy, and it's something called DBT, dialectical behavior therapy, that are proven to be effective for people with personality disorders. However, again, you have to be aware and you have to want to change. And the cluster Bs of all the clusters, with the exception of borderline personality disorder, I'm going to pluck that out for a minute.
Okay.
They're typically not interested in doing anything different. It's everybody else that's the problem. It's not them.
Yeah.
But treatment can be highly effective. Now, there are some studies that suggest that people with like an antisocial personality disorder, that talk therapy only makes them more savvy. They learn how to manipulate. They learn what to say to manipulate, especially if they come across a practitioner who isn't savvy enough to identify what's going on. So the point is, yes, they can be treated. And I hope, because I know there's people listening to this that have personality disorders, and I want to be really, really mindful of like, people with personality disorders are not psychos. They're not psychopaths, right? We have some individuals who happen to be those things and also happen to have some of these personality disorders, but this is not common. I guess I just want everyone to hear that.
Absolutely.
Right?
Absolutely.
Yes. Okay.
I mean, and guys, we all have our stuff. I mean, come on. You know what I mean? I got my stuff. We all have our stuff.
I got 2 hands of stuff, girl.
I mean, I got a bushel. I got a hog farm full of it. But I do want to just mention a couple of things. I know we'll probably have to wrap in a moment, but some of the things that I discovered outside of the documentary.
Yes.
She's not paying child support. In the past, she was offering $50,000 to surrogates.
Oh, that's right. Which she doesn't have $50,000, so
no, she sure doesn't.
That was a wild grift.
In prison, this is an interesting thing. Before she was moved to death row, I believe she was like with, the general population. She caused so much trouble in a prison that they had to move her because she was causing so much. Do you know how hard it would be for a prisoner to cause so much trouble inside of a prison that they would actually have to move you? I mean, that's what's wild. So she was asking, she had like an inmate, a cellmate, somebody who she was convincing them that they did what she did. She was having them write a confessional letter. She had other people she was trying to get other people to write a confessional letter that they did this crime that she did. Okay. We're just going to leave that there.
Oh my God.
She wrote a letter to the FBI saying like, I am really good about what I do. I can help you. And they were like,
okay, so do
no
we see the narcissism in that?
We sure do.
Do we see
Thank
what
you.
I'm talking about?
Oh, wow.
The
That's good.
narcissism to believe that the FBI could learn from you, bitch? Oh, the
Wow.
narcissism.
That's interesting. I
That's
love how
wild.
you, okay. They were like, no, thanks. And the diagnosis that during the court hearing, they had like, I want to say 3 or 4 different diagnoses done on her, defense, prosecution, whatever. And interestingly enough, they said that she wasn't mentally ill. She does have personality disorder.
Right. Oh, good. I'm glad that I know what I'm talking
There you go.
about.
I know.
I didn't know that they said that.
Yes, I know you didn't. And
Okay,
then
good.
they also had a neurologist look at her and they did like an MRI of her brain, much to like what you said. They said that she has frontal lobe dysfunction.
Which is very common with people with antisocial personality disorder and things like that. That is very, very common.
Lastly, we didn't talk about how Wade's coworkers or like his boss and his wife were really invested in this couple and really believed in them. And she had her fake pregnancy belly. She somehow was able to make it move to make it look like the baby was kicking. So that person was completely believing Taylor and was like very much in Wade's ear saying like, you got to take care of her. That's your baby, all this stuff. So I just want to say,
which was her plan, by the way.
How does she get, is that like some sort of electronic like movement thing, or how does she even do that? I don't know.
Here's what I'm going to tell you. People with these issues, if they put that time and effort into something real, they could cure cancer. But instead, they want to fool people, rob people, bilk people, whatever it is that they're looking to do. They will put all their time, resources, brain power, and effort into that, and they'll get it done because they're motivated to do, right?
Wow. Yes.
And if she had that level of motivation towards getting better, anything is possible, but she doesn't, because that's ridiculous to think that you're having inmates write letters like, girl, the jig is up. You're on death row. You've been found guilty. There's no one else that could have, would have, or is. So to me, it just displays, again, this like narcissism, ego, and lack of understanding about herself, others, in the world.
Wow. My last thing is that, just so everybody knows, she has exhausted all the appeals.
Oh, good.
And so it will continue with the death sentence. There's no date.
Now, here's the thing, Amy. I'm going to be honest. I am not usually a proponent of the death sentence. For me, I
it's
feel
a tricky,
like
yes, it
that's
is.
not
Very, very.
for us to decide. However, this woman is a menace to society. It's proof in jail, right, that she's still doing the same old shit.
Yeah.
And this is a very dangerous person that I am grateful she will not be able to hurt, anyone on the outside. I'd be concerned for people on the inside, if I'm being honest.
Yeah.
If she thinks she can get something from them. But I think that this is a case where, for Reagan and for that child, she needs to go away forever.
Yeah.
And I hate to say that, but that's why this case is so icky, because it makes you feel it's just so bad. It's so bad. It's so ugly. But I really hope that through us talking about it today, people have gotten a better understanding of like, because for me too, this is about, right, taking the stigma away from like mental health issues or, things like that. And
I love that. I love it. That's just why I get so happy and so excited about your explanation about all this. And I'm the perfect person to talk to about it because I'm a narcissist. No, because because I'm so, it takes me a little while to understand things. And so I feel like I can ask the right questions over and over again in order to get a real understanding for myself. And then therefore, those out there listening are probably like, yeah, Amy, we got it. The first time she explained it, we didn't need this. But I feel like it helps, you can really put the layers down and explain it. We could talk about it for another hour,
we could.
But
listen, and maybe we'll need to do a part two.
And maybe we could do a whole separate podcast where you do talk about like the personality disorders in general and mental illness in general. Just like a, Psychology 101 would be really interesting. But
Well, if y'all want to hear that, let me know. I'm happy to do whatever people want to hear. But Amy, I really appreciate your voice in this too, because you got all that other information. And I just appreciate you very much, number one, everything you brought to this, number two. And you do represent the average American who is a good person and doesn't see how someone who seemingly is a good person could do something like this, right? And so I think for me, it's just about helping to give people answers, also helping people to understand red flags and keep themselves safe, because there are other Taylors out there.
You're right.
And I guess what I just want to say is, to wrap this up, is if your gut is telling you something is wrong, please listen to it. You don't necessarily need to put your finger on it. You don't need to name it. You don't need to have a litany of backed up reasons. It's just, I believe our gut always knows.
Go the other way, because if you're a very nice person and you're receptive, predators will be looking for you because they want that person that they can persuade little by little. If you're ignoring their bad behaviors and you're letting them squeak in and you're letting this fall by the way, oh, they didn't really mean that. They didn't, surely they couldn't. Oh, I'm a bright light to them.
Yeah.
Run.
Yeah. And also, by the way, predators use something called habituation, which is they step their toe over the line over and over to get you used to it. And then they step it over more, get used to that. And then they step it over more and you get used to that.
Wow. See?
Yeah.
That's
Listen,
exactly.
I'm just trying to, let's
that
keep
makes so
ourselves
much
safe,
sense.
y'all. Safe from the Taylors of the world. Amy, thank you so much. This was actually, it was tough content, but thank you.
I know.
It was lovely.
I did my job, which is showing up and just, asking the questions. I'm so glad that we did this. And thank you. Thanks for your insight and your intelligence and all the work that you've done in your life to get us to this point so that we can understand this stuff. So,
well, thank you,
thanks to our listeners.
Yes. Thank you so much for all the darling Bishes who support us and love us. And so, what I would say is please check both of us out. Check me out at Your Bish Therapist. Check me out on Patreon, patreon.com/YourBishTherapist. And please give Amy and I 5-star reviews if you'd be so inclined and you haven't already. The world is harsh and, it really makes a difference. And thank you all for those that have already done that.
Thanks, you guys. You can find me anywhere you listen to podcasts, Drama Darling. And my Patreon is patreon.com/Drama Darling. Okay.
All right. Thank you all. Bye.
Bye, Melissa.
Bye. Disclaimer. Posts are not intended to diagnose, treat, or provide medical advice. Your Bish Therapist is for entertainment and informational purposes only. The podcast, my opinions, and posts are my own and not associated with past or present employers, any organizations, Bravo TV, Greyheart Productions, or any other television network. The information in YBT podcast and on its social media is provided for general informational purposes only and is not intended to diagnose or treat. Please do not act or refrain from acting based on anything you read, see, or hear on YBT podcast or associated social media. Communicating with YBT via email and or social media does not form a therapeutic alliance. Melissa, operator of YBT, is unable to provide any therapeutic advice, treatment, or feedback.